Welcome back to Botcast. I'm Mansa, your host. Today we have Raj Sadasivam, an AI thought leader, discussing how generative AI transforms healthcare operations. And welcome, Raj, to Botcast.
Thanks, Manasa. Really excited to be here and thankful that you have invited me for this podcast. I'm ready to share my ideas.
Raj, before we dive into the intricacies of generative AI and healthcare, could you share a bit about your background and your professional journey in data analytics and AI?
Sure, Manasa. I have about 22 plus years of experience. I started out my career as a mechanical engineer in consulting, and as well as last 10 years I've been into data analytics, leading teams in both sales and operations for a large IT firm, and then helping accounts grow in the data analytics space. And last 4 years, I was a partner in a startup which was into healthcare analytics. And of course, now my interest focuses on generative AI, which is the new thing, a new technology in this AI field. So I'm ready to share my thoughts here.
That's an impressive journey, Raj. Now, shifting our focus to generative AI and healthcare, the potential impact is truly intriguing. When it comes to market size and the quantum of impact generative AI can bring, what's your perspective? And how do you see this technology fundamentally reshaping healthcare operations and process?
Sure. Yeah. So there have been multiple accounts or multiple, views on this, but the potential is humongous in terms of the economic impact that generative AI is going to create in the healthcare industry. Right. The market size is about close to 18 to 20 billion US dollars, but the economic impact may vary from 300 billion to 1 trillion. They go as high as 1 trillion as per certain estimates. So we'll have to wait and see how things pan out. But the opportunities and the economic impact that this could create is huge.
Fascinating, Raj. Now, navigating the complex healthcare landscape, it's clear that generative AI has huge potential, right? However, this industry does have those unique complexities. Name it numerous stakeholders, multi layered value propositions, and market dynamics, obviously. You have mentioned that. So, what would you say are some key hurdles posed by these healthcare specific challenges, and how can generative AI help address some of these complexities, as it get incorporated into healthcare operations?
Sure. Yeah, you rightly said this industry has multiple stakeholders. The major three of them, the payers, the providers, and the patients, right? And it's not a very linear kind of supply chain kind of setup where the value flows from one stakeholder to another. It's a kind of mix and match kind of setup. And if you see their objectives of each of these stakeholders, the payers, which are the insurance companies, the providers are the doctors or the providers of the care, and the patients are the end customers, end consumers in this whole cycle. They have their own objectives, they have their own goals within this ecosystem, but it is not entirely silos, right? I mean, there are overlapping objectives there, so that increases the complexity in this healthcare system. Secondly, the data and the information is very personalized, right? It's all the personal data which gets stored and information that gets stored. So in order to access that, it requires a lot of hurdle. I mean, we need to cross a lot of hurdles and access that information and data. That throws another complexity in the system. And the third and final one, I would say, is the regulations, right? Regulations and compliances, which the governments across the globe they formulate, and it changes. It is very dynamic, and it also varies from region to region geographically. So whatever is applicable in US may not be applicable in Europe, and whatever is applicable in Europe may not be applicable in APAC or some other region. So these are some of the complexities, the major complexities that I would see in healthcare industry. But how Gen AI navigates these complexities, something that we need to see.
Indeed, Raj. Now, let's bridge theory and practical reality. We have talked about promising potential of generative AI in healthcare. However, to make this potential a tangible reality, overcoming specific challenges is a key, right? Sector specific challenges. When envisioning real world use cases, where this technology can drive impact and what implementation strategies would you suggest to ensure a smooth adoption?
Sure. So, the like I said, the potential for Gen AI in healthcare is huge, and I don't think we would have time to list down everything, the exhaustive list, and every day it keeps changing as well. So, I'd like to touch upon a few of them, and I would like to go by the stakeholder list. So, if you look at the payers, which are the insurance companies, one of the areas that could be transformed through Gen AI is the customer service, right? Where the customer service agents can pull up the information, get the summary of the particular client, and then converse that, translate that to customers on a real-time basis. That is one advantage I could see. The other one, I mean, within this scope, if you see the denials of claim is another major thing wherein Gen AI could be very useful. The summary could be very clear, transparent, and personalized, which the customer service agent could use to convey it to the clients, right? So that way it could help. And combining the traditional numerical AI and the generative AI, the authorization could be made simpler for a particular claim, and it made much faster than what it is in the traditional way. So this is concerning the payers or the insurance companies. So when it comes to the providers, the hospital groups or the doctors, obviously the doctors can use Gen AI in multiple ways. And one of the key areas is when they interact with the patients, right, on a face-to-face basis. Something the doctors can record their the conversation, and that voice can be converted to text and data, and that could pre-populate the EHR through AI, and then the AI could prompt the gaps between what is required in the EHR and what gets recorded. So it makes doctors' life much easier. They don't have to burn down by the admin work and the paperwork, and this could improve the relationship between them and the patients. Second thing, as a hospital organization, hospital operations, chatbots could be employed so that the employees can get their queries answered through chatbots, which could improve their satisfaction, and their productivity could be improved. So when it comes to patients, obviously, personalized chatbots for a particular disease or particular condition can be designed so that their questions can be answered through chatbots. Secondly, the feedback, whatever the feedback they give for their the hospital engagement, can be recorded and summarized with Gen AI and can be used by the hospital facilities, efficiently. So these are some of the use cases. Like I said, these are not very exhaustive, but definitely go a long way in improving the quality and safety of the care that healthcare institutions provide to the patients. Right.
Definitely, Raj. I think you have touched upon high impact use cases. But as with any innovation, challenges are inevitable. From your on ground experience, what key does the healthcare industry specifically face when looking to implement generative AI? So, be it around data constraints or integration complexities or stakeholder alignment. So, what hurdles crop up and how can these be smoothened for any swift and widespread adoption?
Sure. Like I said, the ecosystem itself is very complex. So when it comes to challenges in implementing Gen AI, the first challenge would be on the data front, right? So the data is the basic for any analytics or AI initiative. So accessing the data, there are a lot of privacy hurdles that one has to go through because it's a very personal data. The second thing is mostly the healthcare organizations have data in siloed systems, wherein the data is spread out. So this has to be worked out and made sure the data is ready to be used to implement the Gen AI system. Second thing is the bias and the ethical question and fairness questions that crop up. The societal bias has to be mitigated or eliminated, through initiatives, through frameworks, so that this doesn't expand during the implementation phase. The third thing I would say, like I mentioned before, the regulatory compliances vary from time to time, from region to region, which throws up another challenge in implementing Gen AI. The fourth one would be to build the confidence between the organizations and the users, right? Whether it is patients or the healthcare givers, doctors and nurses, it's still a long way for them to get the trust and confidence in these systems and use them for their everyday operations. So that has to be somehow managed. Last but not least, the technical challenges. The technology keeps changing on a very rapid pace, and somebody needs to be at the forefront in terms of understanding the technology and coming up with the changes in the system. Secondly, there is interoperability requirements between hospitals that has to be managed. And of course, depending on the use case and the size of implementation, there could be implementation cost or investment cost for the computational requirements. These could be mitigated in certain ways. I would like to come up with or convey about six steps which would help mitigate these challenges in adopting Gen AI in healthcare industry. So first step would be to the look at the entire system, the workflows, the operations, and then prioritize your use cases. Start small and then expand. Okay. The second step in this process would be to look at the data and where the data resides and how we can manage the data, build a system which would combine the data wherein your models can be built, right? Third would be to mitigate the risks and eliminate the bias through proper technical and legal frameworks. I mean, we need to understand the risks thoroughly and the biases completely, and then come up with these frameworks and make sure that these frameworks are properly followed. The fourth one would be to implement the or investment into technology and the resources, right? In terms of buying the right software for the particular use cases, and then investing in people in terms of upskilling and training them, and ensuring that there is a human in the entire loop, human input into the entire loop, so that there is an extra checkpoint in terms of how these systems work, right? So I would rather recommend augmentation rather than automation or replacement of resources. And then you train these models within a safety of the firewall, and then do it quickly so that you beat the competitors. So these are some of the high level steps that I would recommend to mitigate these challenges and get this Gen AI thing rolling.
Absolutely valid points, Raj. Now, zooming out as we envision healthcare's future with generative AI solidly integrated, now where do you see the biggest ripples of transformation unfolding? I can certainly think of shifts in business models, patient experiences, and even doctor patient dynamics, right? But keen to hear your insights on how you specifically foresee this technology reshaping the healthcare landscape in the coming years, and where's the highest impact going to be felt in your view?
Sure. So, like I said, the economic and the other softer impacts are the potential for those impacts are very high, right? But the way these things are adopted and implemented is something that everyone needs to watch out. I would, look at three major factors which would affect the way these gets implemented and the benefits get reaped, right? So first one would be the like I said, the accessing the privacy data, wherein we need to go through the compliance and make sure that reap the benefits to the maximum level, but we don't breach the privacy laws or the regulations. The second thing would be to eliminate the bias, focus on that, and make sure that the racial or the privileged and underprivileged or gender biases are eliminated in adopting this. And the third would be the right investment. Just because it's a new thing in the ecosystem, one should carefully evaluate and then do the investment appropriately, so that there is a maximum ROI that could be realized, right? Given these three factors, if these things are done right, the benefits could be numerous. First thing would be, like I said, patient care, patient engagement with doctors can be tremendously improved. The administrative or paperwork from the doctor's side could be eliminated or minimized. The second thing would be personalized care, right? Wherein a particular patient can be, the treatment for a particular patient can be personalized based on his or her condition and, the humongous data that gets fed into the system, right? The third would be value-based care, wherein the payment is based on the value that gets created, or how the patient gets better over a period of time, and the policy pricing can be done more accurately for a particular patient depending on his or her conditions, right? So that would be the third, benefit we could realize through Gen AI in healthcare industry. The fourth and final one could be the equitable care that can be given to patients. The underprivileged gets equal care as a privileged people. One of the use cases that I could foresee is prediction of health outcomes at a later stage, so that the underprivileged can get their care at an earlier stage at a cheaper price than waiting for a longer time and then getting into more expensive kind of treatment and ineffective treatments, right? So all in all, I think Gen AI could help in terms of democratizing the information. The knowledge is spread out equally among all the stakeholders. The second thing would be, more equitable care, where different state of society can get equal amount of care, and then of course the personalized treatment given to patients, where the treatments will be more effective and more efficient as well. Yeah.
Raj, I think you really painted an innovative picture of how Gen AI can shake up things in healthcare. And having said that, I wanted to thank you again for outlining this forward looking AI journey. Really appreciate you sharing your insightful perspectives today, Raj. Thank you for joining us today.
Thanks, Manasha. It was wonderful talking to you and sharing my knowledge as well. Hope to see you sometime soon as well.
Thank you once again. And for our viewers, be sure to subscribe for more thoughtful, provoking discussions. On that note, signing off.